For us, the key thing is moving more to a system of preventative care and away from curative care. Because if we can prevent illnesses, we can save governments costs, we can save people costs on healthcare as well, we can be working more productively at the same time, we can make ourselves fitter and we can make ourselves live longer. Every government in Southeast Asia, including in the Philippines, wants to provide universal healthcare coverage. That's unaffordable unless we tackle the issue in a different way. We also need to, of course, get to a position whereby people aren't facing large out-of-pocket expenditure as well on their healthcare. Because suddenly you get sick and you can't afford treatment, of course, you're going to get sicker. So we need to find a better balance, and there are several aspects to this. One aspect is governments looking at how they're spending their money, seeing they can spend it more efficiently. The other aspect is doing more promotion on self-care. So you're not actually having to provide healthcare facilities for minor ailments. People can treat themselves, look after themselves at home. That leaves more limited resources to be used there for those people that truly are chronically sick. Another aspect is we need to look more about how we can promote private healthcare insurance. Now, for some people, they may think, oh, that's an added expense, but paying a few dollars a month for some health insurance of some level is much cheaper than having to pay an out-of-pocket expenditure later on. So we need to talk to governments about ways to promote private health insurance, either alongside a national scheme or as completely private schemes. And that may come in the forms of governments having to offer tax breaks, for instance, to encourage people to take out those insurance policies. It gives you more money to spend on the things you need to spend it on, whether that's cancer drugs or operating theatres or upgrading and improving hospital and clinic facilities.